When dealing with the menstrual hygiene, there are key areas that the women of reproductive age and the adolescent should know. These are signs and symptoms of menstrual pain we can't do without tackle those areas. They should know the signs and symptoms of menstruation like abdominal or pelvic cramps, lower abdominal pain, bloating and sore breast. We have mood swing and highly irritability on some people, headache and fatigue. Those are signs and symptoms. Then we have the three hygiene practices during menstruation. The three hygiene practices during menstruation, we have wash hands before and after using the restroom and before using the menstrual product. Those are very, very hygiene practices that people should put in place during menstruation. This is part of menstrual hygiene. We also have most common menstrual problem that women do experience. The most common problem like dysmenorrhea or painful cramps and lower back pain. I'm going to highlight how to manage the painful cramps and lower back pain as we continue with our discussion. We also have the women and adolescents. They should know that the normal period lasts between 2 to 7 days, and if it goes beyond that, and you should take an action or see the doctor. But the normal range of period in most of the people, it lasts between 2 to 7 days. That one is very, very important, and people should know. Then we also have to talk about the management of menstrual hygiene in school. How can we manage menstrual hygiene in school? This can be done by provision of knowledge about menstrual hygiene, sanitary products, facilities to understand and manage their menstrual problem. We should also ensure they are within the children or student reach. They should have good access to those things I've highlighted, like sanitary product, provision of knowledge. We should equip them with the knowledge about menstrual hygiene, then facilities to understand and manage their menstrual problem. Also, we should also enable the women of reproductive age and the adolescents, female, to understand the effect. We should also understand effect or poor menstrual hygiene in school. What are the effects of poor menstrual hygiene in school? It affects various areas like school absenteeism, reproductive problems, urinary tract infection in most of the female, withdrawal from social gathering. They don't usually interact during that period. You find them, they isolate themselves or they remain back at home. Or they can get engaged in early sexual intercourse in order to get the sanitary pads for the people in rural area which cannot get enough money to buy the sanitary pads. So it's affect their reproductive. And bring more about reproductive problem issues. So these are the effect of poor menstrual hygiene in school, and we should try much on how to do away with this effect of poor menstrual hygiene in school. If we come together, we can help them sort the problem. We also have barriers to menstrual hygiene. The barriers to menstrual hygiene, we have the poverty. Poverty it's very broad. I can't discuss it all, but it's a major problem, a major barrier to menstrual hygiene. We have discrimination or social norms. Within each community, they have their social norms. Then lack of access to basic services like toilets, sanitary product. Most, like in rural areas, you find it's very, very hard for them to access the basic services. Some area doesn't have enough or adequate toilet even within the schools. There, the sanitary pads to access is a big problem, not even only within the school, but even within the centers within their area. You can find that there is no sanitary pad, even the one they can buy, or they don't have money even to buy the sanitary pads. Those are the barriers to menstrual hygiene. I also want to talk about the causes of menstrual pain. What brings this so-called menstrual pain? Why do someone has to experience menstrual pain? The menstrual pains comes as a result of contraction of the uterine contraction, which happens during each every month. There is that uterine shedding of the uterine lining. During this process, there is contraction of the uterine wall in order to shed off the uterine lining. When this contraction happens, there is hormone known as prostaglandin. This pain hormone, when produced, it generates more of uterine contraction and more of the uterine pain, resulting to this menstrual pain that people experience. Other causes of menstrual pains, we have medical conditions like fibroids, endometriosis, or other familial issue. Familial issue, it's if it's run within your family, it can also cause menstrual pains. Those are the causes of menstrual pain. How can one manage menstrual pain? The management, we can use the home remedies. The home remedies of managing the menstrual pain, we can use application of the nini. You can apply warm compressor on the abdomen. You apply the warm compressor on the lower abdomen part. You can massage the abdomen, massage the abdominal parts. You massage, you just do the massage slowly. Then you can have a warm bath. You can do regular exercise. If you do, the more you do the exercise, the more it increases the blood flow within the body and will make you feel less pain. Then you can do yoga, relaxation techniques that will relax all the entire body. You can also take anti-inflammatory drugs like ibuprofen to relieve the pain relievers during this period. Those are the home remedies on how you can manage or relieve the menstrual pain. Things to avoid during menstrual period. What should you avoid when you are on your menses? Avoid salty food, sugary food, spicy food, avoid alcohol, then avoid also red meats, avoid high fatty diet. The reason why we said avoid salty food, because salt encourage the nini, it encourage more water retention, and when more water is retained within the body, it enhances the bloating process, and this one will affect you during your menstrual period. Those are the key areas that I think I wanted to highlight. For one, as you deal with the menstrual hygiene issue, the women of reproductive age should also know the how does this menstrual pain come, how to manage it, how to go about it. Thank you. Bye bye.